The holiday season is filled with traveling to see relatives and friends, and is also a time to shop for that perfect gift for your grandchildren and family members. Did you know that there are safety tips to follow regarding you and your family's health when you're traveling and shopping for the holidays? Here to share these tips is Baptist Medical Group family medicine physician, Dr. Kacey Gibson. Good morning, Dr. Gibson. Thank you so much for joining us.
Thank you so much for having me back. I really appreciate it.
Well, to get us started, can you tell us a little bit about yourself and how you got into family medicine?
Yes, of course. So I grew up here on the Gulf Coast. This has always been home to me. I did my undergraduate at Ole Miss and then traveled down to South Florida to do my medical school at Nova Southeastern. After that, I had the pleasure of being an Air Force physician for 7 years. But like I said before, the Gulf Coast was our home, so we definitely came back here to raise our family. Family medicine always just seemed like an easy pick for me because I love teaching my patients, talking about preventative care, and it's just something, watching your patients grow, that's really special.
Well, we're very happy to have you back on the Gulf Coast, and I'm sure that Baptist Medical Group is very lucky to have you too. But our viewers are going to be traveling a lot this holiday season, and something that, I didn't think about, but could be an issue is potentially some negative side effects for sitting for long periods of time. Can you tell us a little bit about that?
Yeah, I think that's a great point. When people are traveling over the holidays, thinking about their medical health really isn't something a top topic, I guess you could say. If you're driving for long periods of time, it does put you at high risk for something called a blood clot, and that's where you get a clot in one of your vascular systems, which at times can be pretty significant, but can also be fatal if it goes to your lungs. So some of the recommendations that we say is, if you're driving, stop the car every 2 hours, get up, stretch around, walk around. If you're on a plane, pointing your toes, then bringing them back towards yourself, pumping your calves as you will a couple of times, maybe 10 times every hour. Another easy thing you can do is wear compression hose. You can get those at most of the medical supply stores, and it is kind of a one-size-fits-all. After you talk to your doctor, some patients might be candidates to take a low-dose aspirin whenever they're traveling, and that might help prevent that significant blood clot that we do worry about. Other simple things are you are more prone to getting backaches or muscle spasms, or if you have a history of arthritis, your joints hurting, which just brings us back to the very first point, is don't sit too long, get up, move around, and get that blood flowing.
Some of those dads need to hear that because when I was a child, we weren't allowed to stop for breaks when we were traveling, so that's actually a great point. Can you tell us about what you should be doing, traveling tips when it comes to your prescriptions?
Absolutely. So most airlines do not require for you to have this prescription bottle. So taking only the amount of medication that you need is probably the safest thing to do. If you go to a lot of the drugstores, they'll have some of the pre-portioned medical boxes where you can divide your medications up. Now, one of the things I always see in my practice and just amazes me is a lot of patients don't know what they're taking. So if you do decide to take your medication out of the bottle, make sure you keep a list of what the medication is in the dosing, just in case there is a question. Also, if you're traveling and you have any medications that need to be kept cold or refrigerated, most airlines will let you bring kind of a little ice cooler, a little lunchbox with a little ice pack. The same goes for our nursing mothers and breast milk, that you can bring that, but it just needs to be medication that doesn't exceed the amount of time. If you're going on a 1-hour flight, then of course you would just bring the medication you need for that. I also recommend that my patients bring their medications on a carry-on because you don't know when life will get in the way. Sometimes there's weather delays, sometimes there's life delays, and then that way you always have that medication with you and don't have to worry about not having access to it.
Sure, and when we're in the hustle and bustle of trying to get out the door to get on our way to wherever our final destination is, we may forget our medication. How can we access that medication out of town?
Okay, and this has happened several times in my own practice. So a lot of times the patients will call us and ask for us to their medication to a local pharmacy. And that is appropriate and acceptable. But again, having and knowing what the medications are in the dosages are so important, because I do hear frequently, well, doc, it's in the chart. And that may be true for the medications I prescribe, but patients have other doctors too. And maybe the cardiologist or the pulmonologist gave you another medication. So having an accurate medication list is really helpful. If you are unable to get to your doctor's office because it's a holiday schedule or whatnot, an urgent care is an option, as well as the ER. And usually they can prescribe just the right amount of medication to get you back home.
Great. Well, we want to segue a little bit into another holiday issue that we may not think about. But what about toy safety? When kids are unwrapping the toys, there are all a variety of toys that kids may receive for Christmas. So can you tell us a little bit about how we can prevent some of those things from happening?
Absolutely. So this hits near and dear to my heart because I have a 3-year-old and a 19-month-old. And during those ages, everything goes in their mouth. So you definitely want to think of choking hazards and age-appropriate toys. If you do go toy shopping, most toys in the upper right-hand corner will say this is designated for 0 to 6 months or 3+ years. So definitely sticking to those age-appropriate toys is going to be the best option. If the toy does have batteries, making sure that the battery compartment is secured with a screw is really important because, again, kids love putting things in their mouths. And a lot of those small coin-like batteries can really be a health hazard if they do swallow them. The other big thing is a big hot item on the market is screens, your iPad, your leapfrogs, things to that. And I just want to remind everybody that the American Academy of Pediatrics does not recommend screen time for children under 2 years of age. And over the age of 2, we only recommend 1 to 2 hours. Playing with these screens for long periods of time is actually delaying some of our children's fine motor skills. So, think of those toys that, provoke their imagination, provoke their creativity, gets them outside playing, and again, moving those muscles and getting that blood flowing.
Well, that's really great information. Some things I'm sure people haven't thought of really when thinking about the holiday season. But is there any final word of advice you might have for a viewer in preparation for their holiday time with family?
Absolutely. The holidays absolutely is a time to spend with your family and enjoy your time together. My husband can vouch for this, am a huge planner. And so definitely making lists and thinking, a week in advance, a couple of days in advance before that travel time and referring to that list to make sure you don't forget anything, making sure you have emergency numbers. That's something that people always forget about, having that medication list. But also if you are traveling with small children, thinking about their needs and making sure that you have, drinks and snacks and all of those things, the comfort away from home for them.
Great. Well, thank you so much again for joining us today. We appreciate it.
Thank you so much for having me. I really appreciate it.